I've gotten a lot of messages asking me why I chose not to give my son hydroxyurea. So I'm here to just kind of expound and let you guys know my mindset behind it. So hydroxyurea, also known as hydroxycarbamide, was first tested in sickle cell disease back in 1984. And let me just say this before I go any further. I'm not against medications. You know, if hydroxyurea is working for you, continue to take the medication. If it's keeping you out of crises, continue to keep the medications. I'm here for the individuals that do not take any medications or hydroxyurea, wasn't helpful or caused more harm than good. So again, here's my take on it and why I chose not to. Hydroxyurea initially was rolled out for the treatment of leukemia, melanoma, and ovarian cancers, and then sickle cell disease back in 1984. So at that time, for the sickle cell community, hydroxyurea was shown to decrease pain crises by 50%. So hydroxyurea works. The mechanism of action, they say, is unknown, but what it does is it increases your fetal hemoglobin levels. And when that happens, it decreases the chances of acute chest syndrome and pretty much the flexibility of your red blood cells. And also it's supposed to decrease the amount of blood transfusions you're supposed to get. So that's the positives, that's the pros of taking hydroxyurea. And that's what studies shown when hydroxyurea was rolled out back in the 80s, okay? Sounds good, absolutely. It was something that was needed at the time when we didn't know how to treat sickle cell. So I looked into it. I'm like, you know what? Let me look into this hydroxyurea. So I got a bottle of the medication, opened it, read the contents, etc., what's in the packet. And what does it say when you open the packet? Wear gloves when opening this medication as it is toxic to cells, and do not inhale the particles. If any powder or form of this capsule is broken or spilled, please wipe up at once with a damp cloth and dispose of it in a Ziploc bag and toss. So just reading that, I was like, well, okay, being a mom, I can't even touch the pill that I'm gonna give my child to take. It says that it's toxic to cells. So my thinking is, why am I gonna take a pill that I can't even touch? So if it's toxic to cells, it means it's also going to be toxic to his so-called normal cells or his sick cells that are not sickling. So why would I do that? So I continue to read. It said caregivers should wear rubber gloves while cleaning up the patient's body fluids. If this medication can pass through bloody fluids like urine and feces, vomit, any type of body fluids. You cannot, if you have soiled linen, you cannot wash your linens with another person's linen that is not on the medication because it's toxic, and that person can also be exposed to the symptoms or the chemicals in this medication rather. So also in there, it says to avoid vaccines while you're on the medication. Avoid live vaccines, measles, mumps, rubella, polio, rotavirus, varicella, herpes zoster, yellow fever, flu mist, and it's just on the packet. So now I went a bit further. I read the common side effects. First one, it causes myelosuppression. Myelosuppression means that it decreases your white blood cells, your red blood cells, and platelets. This is a complete hit on your immune system. And already having sickle cell disease, we know that we're anemic, so our red blood cells are low. Some of us have low white blood cells. We have a hard time fighting off infections. So on top of that, it causes infections, it causes skin ulcers up to 35%. It causes hyperpigmentation, so dark spots on your skin, etc. It can cause dark urine. It can cause issues with your kidneys, issues with your liver. Common side effect is that it can cause pain, fatigue, back pain, stomach pain, joint pain, and infertility. Like, I'm not going to take a medication where my child can no longer have children. And then it's also known to cause secondary skin cancer or leukemia. So when you're on this medication, you're not supposed to really be exposed to the sunlight. Again, We are light beings. We're supposed to be in the sun. So for me, it was a no. I looked up other medical studies, other research articles that saw that resveratrol, a lot of people have been asking about resveratrol. Resveratrol is in the skin of grapes, and this is naturally anti-sickling and has been shown to also have the same positive effects of hydroxyurea without the side effects. So for me, I have opted to give my son something that has less side effects. So I went for resveratrol. So I give him that. And I don't give it to him even every day. You know, I have him eat grapes most of the time, or he'll take the resveratrol more, you know, when he would have a crisis or any sign of pain, I'll give him that. But other additives that are in this pill, hydroxyurea, that I did not want in my son's body was the colorants. The red dyes, the yellows, that's all known to cause DNA damage, inflammation. You know, it can cause inflammation in the colon. It can cause gut dysbiosis. It's endocrine disruptors when we're talking about the red 28, the red 40s, the blue dyes, etc. All of these things are found in this pill, and it can cause issues with your reproductive system and your immune system. Okay? There's also another additive in hydroxyurea called titanium dioxide. I'm not sure if that's across the board, if this titanium dioxide is in hydroxyurea, like out of the United States, but in the United States is in hydroxyurea. And titanium dioxide has actually been pulled off the shelves in the UK, and it's not supposed to be ingested. So for me, it's a no. Again, if hydroxyurea is working for you, I'm not here to bash it. I'm here to educate you. I'm here to just read the back of the label for you. If you didn't take the time to look at it, this is what I did. And this is my reasoning for going a little bit further into more functional, natural medicine to find the root cause of what can cause these diseases, or what can cause a sickle cell trigger, and what led me into approaching sacred cell with a more natural approach.